Hello and welcome. Thank you so much for joining us for the Champlain Regional Planning Table for Trans and Gender Diverse Health's 2022 Community Report Back. We are absolutely thrilled to be here today to highlight the work of the RPT over the past 6 years and explore where we are going next. As we gather today to provide the community with a report back on the work of the Regional Planning Table, we would like to begin by acknowledging that the RPT operates on unceded and unsurrendered Algonquin Anishinaabe territory, or what is colonially known as Ottawa. We invite you to join us in reflecting on what this means to you and your intersecting identities. In particular, we encourage you to reflect on how colonialism impacts all of us, and particularly Two-Spirit, trans, and gender diverse Indigenous folks on this land. Colonialism very much shapes our understanding of gender, of sexuality, of health and healthcare. And our commitment in this work is to challenge colonial ways of working and find new ways and better ways to work in solidarity with and towards better health outcomes for Two-Spirit and Indigenous, trans, and gender diverse folks. And so I'll pause for a moment and just encourage everyone who's watching to take a second to reflect on the land that they are joining upon and the histories of that land and the ways in which they, particularly if they are settlers, can further contribute to truth, justice, and reconciliation. The RPT was founded in 2015 with the support of the Children's Hospital of Eastern Ontario, the Youth Services Bureau, the Royal Ottawa, Centretown Community Health Centre, Seaway Valley Community Health Centre, Family Services Ottawa, and the Ottawa Hospital, alongside trans and gender diverse community members and Trans Health Information Ottawa, a local community-led health organization that has ceased operations, but played a key role in advancing trans and gender diverse health in the region. Funded by Ontario Health East, the RPT was formed as a coalition of community members and service providers working together to improve trans, Two-Spirit, non-binary, intersex, and gender diverse health in the Champlain region, and is in fact a phenomenal example of co-creation and community engagement in a context and sector still learning to meaningfully engage trans and gender diverse communities. The RPT is not a service provider, but is rather mandated to support overall system planning on trans and gender diverse health services across the Champlain region. Our fundamental role is to bring service providers and community members together to improve trans health services. On the screen, you can see a snapshot of the Champlain region, including Ottawa and the surrounding areas. My name is Faye Johnstone. I use she and they pronouns, and I'm the Executive Director of Wisdom to Action, the RPT's current system planner. I am also a 2S LGBTQ inclusion educator and facilitator. I have my BSW and MSW from Carleton University, and my fun fact that I can never not share is that I am the proud mother of 3 very feisty ferrets. Lindsay, would you like to introduce yourself next?
Thanks, Faye. Hi, my name is Lindsay James. I use she, her pronouns, and I'm the Director of Primary Care at Centretown Community Health Centre. Our organization hosts a trans health clinic using an informed consent model for clients aged 17 and up who are interested in hormone starts or getting a surgery assessment. Centretown also offers gender journey support groups and trans health counseling in addition to many other 2S LGBTQ+ services. Ollie, over to you.
Hello, my name is Ollie Thorne. My pronouns are they, them, and he, and I'm currently a sitting community member on the RPT. I am also a facilitator with support and education for trans youth safety. We are the only buy-in for trans youth group and advocacy collective in the area. Safety organizes community events monthly and advocates for the demedicalization of trans identities and for accessible gender-affirming healthcare. I am currently finishing up my MA in Indigenous Canadian Studies at Carleton University, with my research focusing on transgender and non-binary youth receiving care in specialty gender clinics.
Amazing. Thank you both for introducing yourselves and for joining us today, and for all that your organizations are doing for trans and gender diverse folks in this region. Now, for our audience, our purpose for today is to explore the historical and contemporary state of trans health services in the Champlain region and provide community with a high-level report back regarding our work as a table over the past 6 years. Today, we will share our successes, our opportunities, and our challenges as we continue the work to improve trans and gender diverse health services in the Ottawa and surrounding areas.
Before we dive into the work of the RPT, we would like to explore the historical and contemporary state of trans healthcare and services in Ottawa and the surrounding areas. In 2016, the RPT's inaugural report titled Planning for Culturally Safe Primary Health, Mental Health, and Community-Based Service Delivery for Trans, Two-Spirit, Intersex, and Gender Diverse Communities in the Champlain region sought to build an understanding of trans health services in the region, and this is what we found. Trans health services in the Champlain region have historically lacked strong collaboration and sustainable funding. Unclear pathways to care, lengthy wait times for medically necessary services, insufficient wraparound supports for trans and gender diverse communities, all and more were identified as key issues in the RPT's inaugural report. Significant additional barriers were identified for Black, Indigenous, and communities of color, Francophone communities, and rural communities. In short, there has been and continues to be significant barriers to trans health services and to improving the overall health and well-being of trans, two-spirit, intersex, non-binary, and gender diverse communities in the Champlain region.
As Ollie mentioned, our inaugural report published in 2016 was a groundbreaking document for the region, bringing together community and provider input to provide a comprehensive overview of the state of trans health services and to map out recommendations to improve trans and gender diverse health in the region. Beyond mapping the state of trans health services, we connected with community members and service providers to ask the question of what could we do differently and what could we do better. These 9 recommendations identified through the process have acted as the foundation of the RPT's work in the years since. These 9 recommendations are the vehicle through which the RPT is striving to improve trans health in the Champlain region. The 9 recommendations identified by the RPT's inaugural report and guiding our work to this day include: first, stabilize and augment existing services; second, create a systems planning position; third, improve pathways between service providers; fourth, build capacity and cultural competency across mainstream health and social service organizations; fifth, formally engage trans and gender diverse communities in the service delivery infrastructure; sixth, expand and develop new services in key areas, namely within Francophone and Indigenous centered services; seventh, build capacity for service delivery in rural areas, given that trans and gender diverse communities face particular gaps in care outside of urban centers; eighth, maintain a funded RPT so this planning table and this coalition can continue doing the groundbreaking work that it does; and lastly, ninth, develop a standardized process for collecting sociodemographic data so we can capture a clear picture on the state of our communities and the impact of our work. With that context laid out, we'd now like to shift to an overview of the work of the RPT in the past 6 years and our actions to meet these 9 foundational recommendations.
Thanks, Faye. So in the spring of 2019, the RPT commissioned a review of hormone initiation services in Champlain, which was conducted by Connect to Knowledge, the RPT's system planner at the time. The review included a literature review and engagement with community members and key stakeholders, followed by an iterative design process. The ensuing report led to an RPT-endorsed recommendation to stabilize and expand Centretown Community Health Center's trans health program, which was ultimately successful. This was a significant victory for trans health services in the Champlain region. Later in 2019, Centretown Community Health Center acted on feedback from previous consultations to explore areas of concerns raised by community members and hosted 2 co-design sessions. These sessions resulted in the development of 2 videos and a frequently asked questions webpage intended to better share information about Centretown Community Health Center's trans health program. Feedback from community members also informed the decision of the trans health program to offer surgery assessments for trans and gender diverse community members. Given that demand for trans health services outpaces capacity, Centretown Community Health Center continues to explore avenues to reduce wait times and build regional primary care capacity for trans health services.
Thank you so much, Lindsay. In the past year, the RPT has also worked to explore the needs of seniors in the trans and gender diverse community across the Champlain region. We created an engagement strategy to outreach to seniors and connect through a survey and key informant interviews to inform a report on the unique health and healthcare related needs of trans seniors in the Champlain region. Due to a number of factors, including isolation commonly experienced by trans seniors, and despite ongoing research, only 5 key informants were identified and participated in this process. But this limited sample provided key insights into the social and health needs of trans seniors in the region, and their insights and perspectives are continuing to inform the work of the RPT, in particular in our next fiscal year, 2022-2023. We've also begun collaborating and are increasingly collaborating with Ontario Health teams. In the past year, the RPT has reached out to the Ontario Health teams in the region to explore opportunities for collaboration and, most importantly, to ensure that trans health was on their radar. We supported the Ottawa Ontario Health team to engage with 2S LGBTQ+, trans and gender diverse stakeholders to inform the development of their health equity chart. Given that OHTs have only come online in the past fiscal year, these efforts are preliminary, and ongoing outreach and collaboration will continue to ensure that we are working with our primary care partners and with the Ontario Health teams to advance trans health services and build capacity within our primary care services for gender affirming care procedures.
The RPT has continued and expanded our efforts alongside Centretown Community Health Centre and other partners to explore the viability of a more comprehensive trans health capacity building strategy for the Champlain region. Related to this work, the RPT is also exploring the possibility of creating a community of practice around trans health provision in the region.
Recognizing that there are, of course, additional barriers faced by rural and remote trans and gender diverse folks within the region, the past few months of the RPT's work has focused on rural outreach. We have sought to reach out to rural providers, east, west, and south, to explore their needs and barriers to building capacity and expanding the availability of trans and gender diverse health services. In connecting with these providers, we've integrated them into our trans health service, connected them with providers such as Centretown Community Health Centre, and are continuing to support these organizations on their journeys towards trans inclusion and expanded trans health services. This work is currently underway with potential collaborations continuing to be explored and relationships strengthened, but we are confident that we will continue to build the availability and accessibility of trans health services outside of Ottawa's downtown core too. The RPT has also explored existing resources and efforts underway pertaining to the modernization of e-health records, particularly with respect to sex markers. We have explored resources developed by Rainbow Health Ontario, by TransCare BC, and similar entities. With few exceptions, there is minimal movement across the sector in terms of updating our e-health records with respect to sex markers, due in large part to the role of third-party providers from the private sector who manage e-health software, and with such software being fairly difficult and involved to change. However, the RPT has been working with a group led by the eHealth Center of Excellence to further explore this topic and to support the development of best and promising practices in terms of eHealth systems and inclusive data collection and intake processes for trans and gender diverse community members.
The RPT recently convened a meeting with key providers in the region to explore gaps in existing community and social services for trans and gender diverse communities and identify opportunities to address said gaps through strengthened collaboration and the development of wraparound supports for trans and gender diverse community members.
Alongside Centretown Community Health Centre, Max Ottawa, and Dr. Irina Druce, the RPT is developing a short series of learning videos aimed at primary care providers. These videos will feature local trans health service providers and trans community members and aim to build capacity by covering key topics in trans health service delivery, including hormone starts, surgical consults, inclusive care practices, and pediatric trans healthcare.
In the past year, the RPT has also worked alongside key stakeholders and community members to develop an exciting new website for the RPT that seeks to improve the state of trans health in the Champlain region through 2 key functions. First and foremost, the site aims to support trans and gender diverse community members to navigate through and find access to transition-related and general trans-inclusive health services in the Champlain region. Given that access and information about trans health services continues to be difficult to find for many trans community members, our hope for this site is that it will provide some digital infrastructure to help simplify and streamline access to care for members of our community. Second, the site brings together pertinent information and resources for health and social service providers, including information on transition-related healthcare, the provision of inclusive care, and local training and mentorship opportunities. It will be a one-stop shop for service providers, primary care physicians, nurse practitioners, social workers, and more to learn about trans health in the region, to access education and capacity building opportunities, and to get themselves connected to our broader trans health system in this region. We've coordinated to launch the website and ensure dissemination across key organizations, partners, and communities. You can now check out the brand new site in both English and French at www.transhealthottawa.org.
In the past year, the RPT worked to refine the intended scope and function of the Community Advisory Table and successfully supported the RPT to implement a recruitment process which enabled the selection of the inaugural CAT members. The CAT is now up and running with 8 members from trans and gender diverse communities and is well positioned to inform RPT priorities, support greater community input within the RPT and more broadly, and take on their own conversations and activities related to trans health issues in the Champlain region. If you're interested in getting involved with the CAT, we will be looking for new members on an annual basis. Stay tuned for updates on the new RPT website.
Awesome. Thank you so much, Ollie. And I am so excited to see an additional vehicle through which trans and gender diverse community members can weigh in on the work of the RPT and our leadership and efforts to improve trans health in the region. As we look ahead into the 2022-2023 fiscal year, Wisdom to Action has collaborated with the RPT and the Community Advisory Table to identify 6 recommended priorities for 2022-2023. First, we plan to develop and seek funding for a trans health capacity building strategy for the region in collaboration with Centertown Community Health Center. Second, we will continue to build relationships with Two-Spirit communities and Indigenous organizations to advance and expand the provision of trans health services and build mutually beneficial and reciprocal relationships to improve access to availability of culturally competent trans health services. Third, we will similarly engage and further outreach with Francophone service providers in the region to address barriers and gaps in care for Francophone, trans, and gender diverse community members. Fourth, we will develop a regional community of practice to expand opportunities for knowledge sharing and capacity building, and to ensure that any provider who wants to be connected and learning about trans health services in the region has access to mentorship and support from other providers. Fifth, we will continue to support the Community Advisory Table to undertake activities of its own, including panels and educational opportunities, efforts on self-advocacy and resource development to equip trans people and young folks in particular with the tools and resources to advocate for themselves in health and social service contexts. And sixth, we'll explore additional funding opportunities to bolster trans health services within the region, recognizing that despite all of the efforts in place currently, there simply is too much demand and insufficient supply, and that we need to scale up the interventions and services available to trans and gender diverse communities in the region. As we move forward, we are well aware that there is so much more to be done, but we are equally proud of what we have accomplished over the past 6 years. This work is not over, and it will not be over for a long while yet. There are many, many improvements still to be made within our trans health system, within our health and social service system more broadly. We stay committed to working towards the improvement of trans health services in the Champlain region, and we are absolutely excited and ecstatic to continue working closely with trans and gender diverse communities and community members towards that mutual goal. As we bring this video to a close, we encourage you to stay in touch with us. We want to hear from you, whether you're a community member or a service provider, or whether you straddle both worlds. Please reach out to us, engage with our team, and help us continue to advance and improve trans and gender diverse health services in the region. You can contact us through our new website, www.transhealthottawa.org, or email us at either alex@wisdomtoaction.org or transhealthplanning@gmail.com. With that, I want to share my heartfelt thanks, merci beaucoup, miigwech, and thank you so much for watching this video and joining us as we continue to share more about our work and galvanize more action and leadership across the region on trans and gender diverse health.